Welcome to the PubMed Daily Review for May 29, 2026. Today we scanned 469 new open access papers across 106 journals. In this video, we'll cover 10 trending research topics and 10 selected papers for detailed analysis. Trend 1 of 10, Public Health and Chronic Disease. This trend explores public health strategies, interventions, and education for chronic disease management and prevention across diverse populations and settings. This cluster covers 61 papers. Representative work includes chronic stroke rehabilitation interventions in primary healthcare settings, a scoping review, self-management experiences and needs in patients with chronic obstructive pulmonary disease, a metasynthesis of qualitative studies, and individual and spousal weight trajectories and their associations with health-related quality of life. A longitudinal population-based cohort from the Tehran Lipid and Glucose Study, 2001 to 2018. Trend 2 of 10, AI and Cancer Pathology. Applying artificial intelligence and computational pathology methods to improve cancer diagnosis, prognosis, and understanding. This cluster covers 19 papers. Representative work includes immunotherapy for early-stage cutaneous squamous cell carcinoma, cogitations of a computational pathologist, artificial or computational rethinking intelligence in the age of algorithms, and swarm intelligence-guided ROI selection for deep learning assessment of HER2 in colorectal cancer. Trend 3 of 10, Brain function and mental health. Studies exploring brain structure, function, and their impact on mental health, cognition, and related disorders. This cluster covers 53 papers. Representative work includes intestinal colonization of germ-free mice with indole-producing E. coli modulates the central and peripheral endocannabinoidome, mild functional impairment. Definition and diagnostic criteria, and the correlations of insomnia symptoms with psychopathology and hematological parameters, as well as gender differences in patients with schizophrenia. Trend 4 of 10, Molecular Mechanisms and Therapeutics. This trend investigates molecular mechanisms underlying diseases, exploring signaling pathways, genetic factors, and novel compounds for therapeutic development and intervention. This cluster covers 60 papers. Representative work includes synthesis of coumarin derivatives and evaluation of their antioxidant activities against multiple free radicals. MIR 140-5P inhibition alleviates LPS-induced cholangitis in rats and is associated with modulation of the NF-kappa B signaling pathway, and Loganin alleviates oxidative stress-induced apoptosis by modulating mitochondrial function and STAT3 signaling in DSS-induced colitis and H2O2 injured CACO2 cells. Trend 5 of 10, Advanced Materials and Catalysis. This trend explores novel materials and advanced processes for catalysis, sustainable applications, and material property enhancement. This cluster covers 41 papers. Representative work includes earth-abundant coamine C Husler alloy as a promising catalyst for the hydrogen evolution reaction, sacrificial polyvinyl alcohol substrates to transfer atomic layer deposition, grown dielectric thin films, and sustainable supercritical mechanochemical process. Trend 6 of 10, Environmental Health and Ecology. Investigating environmental factors, their ecological impacts, and consequences for human health and well-being. This cluster covers 65 papers. Representative work includes temporal evolution of spatial water quality heterogeneity in Oman's largest water supply reservoir, time-varying exposure to element mixtures, and children's cognition at 5 years of age. Findings from the New Hampshire birth cohort study, and fertilization management reshapes plant-nematode interactions across global ecosystems. Trend 7 of 10, Applied Physics and Engineering. Research applying fundamental physical principles and advanced modeling or experimental techniques to address diverse engineering challenges. This cluster covers 31 papers. Representative work includes experimental study of the sand deposition patterns on railway tracks under different subgrade structures in desert areas, a novel three-phase switched capacitor multilevel inverter for PV applications, and engineering turbulence resilience in Bessel vortex beams through partial coherence and topological charge pairing. Trend 8 of 10, Cancer Biology and Therapeutics. This trend explores diverse aspects of cancer biology, from molecular mechanisms and environmental drivers to advanced diagnostics and therapeutic strategies. This cluster covers 37 papers. Representative work includes distinct epigenetic alterations and accelerated mitotic aging define second primary breast cancers, pancreatic ductal adenocarcinoma with ITSN1, ALK fusion, sustained response to alectinib with 19-month progression-free survival, and microplastics as both a driver of genitourinary cancers and a deliverer of treatments. Trend 9 of 10, Clinical Disease and Therapeutics. This trend explores research on human diseases, their diagnostic markers, and therapeutic interventions. This cluster covers 49 papers. Representative work includes Current and Future Perspectives of LDL-C-Lowering Therapies, 2026, Carboxyhemoglobin Tracks Acute Arterial Desaturation in Healthy Volunteers, a pooled analysis of 4 controlled desaturation studies, and Neonatal Bacterial Meningitis, the elusive search for markers of severity. Trend 10 of 10, Advanced AI and Machine Learning. This trend explores diverse applications and methodological advancements in artificial intelligence and machine learning, including interpretability and deep learning. This cluster covers 53 papers. Representative work includes Reliability and Readability of AI Platforms for Pediatric Health Advice, a comparative analysis, Expected Depth Selection for Interpretable Decision Trees, and Colorless Image Processing Technique combining chromaticity transfer and image feature extraction in visual graphic design. Up next, our first paper out of 10, Reliability and Readability of AI Platforms for Pediatric Health Advice, a comparative analysis by Dilara Lahut and Nalan Karabayer from Social Pediatrics Department, Health Science Institute, Istanbul Medipol University, Istanbul, Turkey. This paper was selected because it directly addresses a highly pressing and rapidly evolving societal challenge regarding the reliability and safety of AI-generated health information, particularly for vulnerable populations like children, offering critical. Let's break down its key contributions. Hello, everyone. Today, we're diving into a critical topic, the use of AI platforms for pediatric health advice. As these large language models become more prevalent, many caregivers are turning to them for quick answers. But how reliable, useful, and understandable is this advice? This paper tackles that very question, evaluating the performance of 4 popular LLMs when faced with real-world pediatric health queries. The researchers designed a robust study to compare these AI platforms. They selected 4 prominent large language models and posed a curated set of 28 real-world pediatric questions, mimicking how a caregiver might ask them. The responses were then rigorously evaluated by 4 pediatricians under blinded conditions, using a modified Discern instrument for reliability and a global quality score. Readability was also assessed using standard indices, providing a comprehensive look at each model's performance. Let's look at the key findings. Interestingly, Grok achieved the highest scores for reliability and structural rigor, while Gemini was rated highest for overall perceived usefulness. A critical finding was that none of the models consistently met health literacy targets for patient materials, meaning their outputs were often too complex for the average user. DeepSeek, however, did produce the most readable outputs, even if its expert ratings were lower. Encouragingly, the study did not identify any overtly unsafe advice from these platforms. So, what does this mean for clinical practice and future development? This study highlights that while LLMs can provide moderately useful pediatric health information, they are not yet ready for routine patient-facing use. Their biggest hurdle is readability. The advice is often too complex for the average person. Moving forward, developers must prioritize making these platforms more understandable, ensuring consistent quality, and improving the sourcing of their information. This will be crucial for LLMs to truly become a reliable and safe resource for caregivers. Up next, our second paper out of 10, Lifespan Normative Modeling of Brain Microstructure by Julio E. Villalonrena and Paul M. Thompson from Imaging Genetics Center, Mark and Mary Stevens Institute for Neuroimaging and Informatics, Keck School of Medicine, University of Southern California, Los Angeles, California, USA. This paper was selected because it introduces a foundational, large-scale normative model of brain white matter microstructure, which is a significant advancement in neuroimaging and provides an unprecedented tool for detecting brain abnormalities across A. Let's break down its key contributions. Understanding the brain's normal development and aging is crucial for identifying disease. For many brain metrics, we have established normative models, but a significant gap existed for white matter microstructure. This lack made it challenging to pinpoint subtle deviations that could indicate early signs of neurological or psychiatric conditions. This research aimed to fill that void by creating a comprehensive, large-scale normative model for white matter microstructure. To build this groundbreaking model, researchers gathered an enormous amount of data. They utilized 19 international diffusion MRI datasets, encompassing over 54,000 individuals ranging from 4 to 91 years old. Using a sophisticated statistical technique called hierarchical Bayesian regression, They meticulously modeled the statistical distribution of white matter metrics as a function of age and sex. This allowed them to derive average lifespan trajectories and corresponding centile curves for each white matter region, creating a robust reference. The team successfully created a large-scale normative model based on an impressive 583 individuals, spanning an age range from 4 to 91 years. This model provides detailed lifespan trajectories and centile curves for white matter microstructure. Crucially, they demonstrated the model's practical utility by applying it to detect and visualize white matter microstructural deviations in conditions like mild cognitive impairment, Alzheimer's disease, and 22q11.2 deletion syndrome. This showed the model's power in identifying disease effects. This research represents a significant leap forward, providing the first large-scale normative model for brain white matter microstructure. This model offers a crucial common reference for researchers and clinicians to identify brain abnormalities with greater precision. Its demonstrated utility in conditions like Alzheimer's disease suggests its potential for earlier diagnosis and better understanding of disease progression. Importantly, these models are publicly available and designed to be adaptable, ensuring they can evolve and contribute to future advancements in neuroscience and clinical practice. Up next, our third paper out of 10, Safety Analyses of the INAVO 120 Randomized Phase 3 Trial of Inavolisib or Placebo with Palbociclib fulvestrant in patients with PTK3CA, mutated, hormone receptor positive, HER2, negative, endocrine-resistant advanced breast cancer by S.A.M. and D. Jurek from Seoul National University Hospital, Seoul National University College of Medicine, Cancer Research Institute, Seoul National University, Seoul, Republic of Korea. This paper presents crucial safety data from a Phase 3 clinical trial, which is the gold standard for evaluating new treatments and directly impacts patient care for a difficult-to-treat, advanced breast cancer subtype. Let's break down its key contributions. Hello, everyone. Today, we're diving into the safety data of a crucial new treatment for PTK3CA, mutated advanced breast cancer. This disease presents significant challenges, and while new therapies like inavolisib offer hope for improved survival, it's equally important to understand how well patients tolerate them. This study specifically addresses the safety and manageability of this promising drug combination. This analysis comes from the INAVO 120 randomized Phase 3 trial, a robust study designed to evaluate the inavolisib combination. Researchers enrolled patients with PTK3CA, mutated, hormone receptor positive, HER2, negative, endocrine-resistant advanced breast cancer. Patients were randomly assigned to receive either inavolisib or placebo, both in combination with palbociclib and fulvestrant. The primary focus of this specific analysis was to thoroughly assess the safety profile and management strategies for key adverse events over a median follow-up of over 21 months. The results showed that while hyperglycemia was the most common adverse event leading to dose interruptions, affecting 27.2% of patients, it typically occurred early, around 7 days after starting treatment. Importantly, no prediabetic patients had to discontinue inavolisib due to hyperglycemia. Other notable events included stomatitis, leading to interruptions in 9.9% of patients, and rash, which was less frequent at 1.2%. Overall, these adverse events were largely reversible and effectively managed with supportive medications and dose adjustments, demonstrating a generally manageable safety profile. In conclusion, this comprehensive safety analysis confirms that the inavolisib combination therapy has a generally manageable and tolerable safety profile. While adverse events like hyperglycemia and stomatitis are common, they can be effectively controlled with proactive management strategies and supportive care. This crucial safety information, alongside the previously demonstrated efficacy, strongly supports the clinical utility of inavolisib for patients with PTK3CA, mutated advanced breast cancer, providing valuable guidance for clinicians in treatment planning and patient counseling. Up next, our fourth paper out of 10, Advancing Radiology Foundation Models with Reasoning Through Step-by-Step Verification from Daily Reports by Ziqing Fan and Weidi Xia from Shanghai Jiaotong University, Shanghai, China. This paper was selected because it introduces a highly novel and impactful two-stage pipeline for training radiology AI models that incorporates structured clinical reasoning from daily reports, directly addressing the critical need for more interpretable and clinically relevant AI. Let's break down its key contributions. Current medical AI models often fall short because they don't incorporate the structured reasoning that expert clinicians use daily. This gap is crucial, as it limits their ability to perform complex tasks and gain trust. Addressing this could significantly improve diagnostic outcomes and make AI more transparent and reliable in healthcare. Our team developed ChestX-Reasoner, a novel radiology diagnosis multimodal large language model. We trained it using a two-stage pipeline, incorporating process supervision directly from clinical reports to mimic radiologists' step-by-step reasoning. To rigorously evaluate this, we also introduced RADR-BenchCXR, a comprehensive benchmark, and RADR score, a new metric to assess reasoning quality. The results were quite impressive. ChestX-Reasoner showed a 16% improvement in reasoning ability compared to leading medical models, and an 8.5% improvement against general-purpose models. Furthermore, its diagnostic accuracy saw substantial gains, improving by 3.3% to 24% over existing baselines. These numbers clearly demonstrate the power of integrating structured reasoning. This study highlights a critical advancement. Incorporating explicit reasoning steps directly from clinical practice can dramatically improve AI's diagnostic capabilities in radiology. This not only boosts accuracy, but also enhances the reliability and transparency of these models, which is vital for clinical adoption. Moving forward, we believe this reasoning-enhanced approach holds great promise for other medical imaging tasks and modalities. Up next, our fifth paper out of 10. Charting Human Organogenesis Across the Carnegie Stages from a Whole Embryo Perspective by Jishua Pan and Guoyan Ding from Institute of Reproduction and Development, Shanghai Key Laboratory of Reproduction and Development, Obstetrics and Gynecology Hospital, Fudan University, Shanghai, China. This paper was selected because it addresses a fundamental and long-standing challenge in developmental biology by providing an unprecedented whole embryo, spatiotemporal transcriptomic atlas of human organogenesis across critical Carnegie stages, which significantly. Let's break down its key contributions. Good morning/afternoon, everyone. Today, we're diving into a fascinating paper that explores the critical period of human development known as the Carnegie stages. This is when our organs first form, and many congenital disorders can originate. Understanding this window at a whole embryo scale has been incredibly challenging, but recent breakthroughs in genomic technologies are finally allowing us to bridge this knowledge gap. The paper we're discussing highlights a groundbreaking spatiotemporal transcriptomic atlas of post-gastrulation human embryos, specifically covering Carnegie stages 12-23. This atlas was meticulously constructed using advanced spatial and single-cell genomics techniques. It provides an unprecedented, comprehensive molecular map of human development, moving beyond previous, more fragmented approaches. This remarkable atlas yielded a wealth of biological insights. It revealed intricate details about early cardiac patterning and provided a clearer understanding of brain regionalization and the precise timing of neurogenesis. Furthermore, it identified tissue-specific susceptibility to prenatal infections and shed light on spatially resolved allelic imbalance. These findings represent a significant leap in our understanding of human embryology. So what's the big picture here? This atlas is not just a dataset. It's a foundational reference resource that will profoundly impact our understanding of human development and the origins of congenital disorders. It signals a crucial shift towards integrated developmental frameworks, bridging embryology, genetics, and disease mechanisms. Moving forward, the field will need to focus on harmonizing multimodal datasets and leveraging computational biology and AI to unlock even deeper insights. Up next, our sixth paper out of 10. Monitoring in vivo transcription with synthetic serum markers by Sho Watanabe and Jerzy Osablowski from Department of Bioengineering, Rice University, Houston, Texas, USA. This paper was selected because it introduces a highly novel and broadly applicable platform for non-invasive, real-time monitoring of gene transcription in vivo, which represents a significant technological leap with the potential to revolutionize. Let's break down its key contributions. Understanding how genes are turned on and off in living tissues is incredibly important for both basic biology and developing new medicines. However, our current methods usually require us to collect tissue after an organism has died, which means we miss out on real-time changes. This paper tackles a fundamental challenge. How can we monitor gene activity in living systems without causing harm? The researchers developed an innovative platform called INTACT, which stands for in vivo tracking of active transcription. They combined two cutting-edge tools, synthetic serum markers, known as RMAs, and specialized RNA-based sensors. This system was designed to detect specific mRNA levels, and they tested its capabilities in both living mouse brains and in tissue culture, demonstrating its versatility. The study successfully demonstrated that the INTACT platform could measure the expression of both engineered transgenes and important natural transcripts, such as CFOS and ARC. This capability was shown to work effectively in living mouse brains, as well as in controlled tissue culture environments. Crucially, the system allows for these measurements to be taken through a simple blood draw, avoiding invasive procedures. This research introduces a truly groundbreaking tool that allows us to peek into the real-time genetic activity of living organisms without invasive procedures. While more studies are needed to explore its full potential across various biological systems, the intact platform holds immense promise. It could transform how we understand disease progression, develop new therapies, and even lead to non-invasive diagnostic tests in the future. Up next, our 7th paper out of 10, Long-Term Spatiotemporal Evolution of Drug-Resistant Mycobacterium Tuberculosis in China by Yiwang Chun and Qian Gao from Key Laboratory of Medical Molecular Virology, MOE/NHC/CAMS, Shanghai Institute of Infectious Disease and Biosecurity, School of Basic Medical Sciences, Shanghai Medical College, Fudan University, Shanghai, China. This paper was selected because it provides an unprecedented, large-scale genomic analysis of drug-resistant Mycobacterium tuberculosis evolution across China, offering critical insights into a major global health threat and informing public health strategies. Let's break down its key contributions. Tuberculosis has been a global health challenge for decades, with antibiotics playing a crucial role in treatment. However, the long-term impact of these drugs on the evolution of Mycobacterium tuberculosis, particularly its drug resistance, remains a significant unknown. This study aimed to shed light on these complex evolutionary dynamics, focusing specifically on the situation in China. Researchers analyzed a massive dataset of over 18,000 Mycobacterium tuberculosis genomes collected from across China. Their primary method involved reconstructing the temporal and spatial evolution of drug resistance by identifying specific mutations. This large-scale genomic approach allowed them to track how resistance developed and spread over the past 2 decades within the Chinese population. The analysis of over 18,000 MTB genomes showed that drug resistance mutations arose repeatedly, leading to hundreds to over 1,000 distinct drug-resistant clades. Most of these clades emerged within the past 2 decades. Interestingly, transmission of these resistant strains was largely confined to individual provinces, but their geographical spread was significantly influenced by human mobility and the bacteria's own fitness. This study provides crucial insights into the long-term evolution of drug-resistant tuberculosis in China, emphasizing that resistance is not a static problem, but a constantly evolving challenge. It underscores the importance of understanding both bacterial adaptation and human population movement in shaping local epidemics. Moving forward, effective control strategies for drug-resistant TB will need to integrate these complex epidemiological factors. Up next, our 8th paper out of 10. Recurrence in the chemotherapy regimen of bladder carcinoma originates from quiescent epidermoid-like cells by Duong Zhou and Song Wu from Department of Urology, South China Hospital, Medical School, Shenzhen University, Shenzhen, China. This paper was selected because it employs advanced lineage tracing and single-cell sequencing to mechanistically identify a specific quiescent cell population responsible for chemotherapy relapse in bladder cancer, directly addressing a fundamental and pressing challenge in cancer treatment. Let's break down its key contributions. Cancer relapse after chemotherapy is a significant hurdle in treating many cancers, including bladder carcinoma. Despite initial success, many patients experience recurrence, which often leads to poor outcomes. This study aimed to uncover the specific cellular mechanisms and evolutionary pathways that drive this relapse, providing crucial insights into how we might overcome this challenge. Researchers utilized a sophisticated approach, combining CRISPR/Cas9 based lineage tracing with single-cell RNA sequencing in mouse models of bladder carcinoma. This allowed them to meticulously track the evolution of cancer cells both with and without chemotherapy. Their goal was to identify specific cell populations and molecular pathways responsible for tumor recurrence, providing a detailed look at the underlying biology. The study revealed that a specific population of epidermoid-like cells can survive chemotherapy in a quiescent state. These cells then reactivate, initiating tumor relapse and forming distinct tumors through various evolutionary paths. Crucially, they identified insulin-like growth factor-binding protein 5, or IGFBP5, as a key co-regulator driving aggressive progression and squamous features. Inhibiting IGFBP5 significantly suppressed both chemoresistance and the malignant behaviors of these relapsed tumors. This research provides a profound understanding of how bladder carcinoma recurs after chemotherapy, pinpointing quiescent epidermoid-like cells as the culprits. The identification of IGFBP5 as a key regulator offers a tangible new therapeutic target, potentially revolutionizing how we approach treatment for relapsed bladder cancer. While these findings are from mouse models, they pave the way for developing innovative strategies to combat chemoresistance and improve patient outcomes in the future. Up next, our 9th paper out of 10. In vivo iron mapping in patients with Parkinson's disease using deep learning-based susceptibility source separation MRI by Hyung-Geology Shin and Janik Prasan from FM Kirby Research Center for Functional Brain Imaging, Kennedy Krieger Institute, Baltimore, Maryland, USA. This paper was selected because it introduces a highly novel and specific AI-assisted imaging framework that significantly advances the diagnostic precision for Parkinson's disease by uniquely mapping pathological iron accumulation, addressing a critical unmet need in neurodegenerative. Let's break down its key contributions. Parkinson's disease is a debilitating neurological condition, and we know that iron accumulation plays a significant role in its progression. However, traditional MRI techniques often struggle to specifically identify this iron, as they can't distinguish it from other magnetic sources in the brain. This lack of specificity makes it challenging to fully understand the disease's mechanisms and develop targeted treatments. This study introduces an innovative AI-assisted MRI technique designed to overcome these limitations. Our researchers conducted a case control study involving 25 Parkinson's disease patients and 26 healthy controls. The core of the study was a novel AI-assisted susceptibility source separation framework, which used deep learning to specifically identify paramagnetic iron. This advanced technique was compared against existing MRI methods to see if it could provide more precise measurements. The primary outcome was the change in paramagnetic susceptibility, or PARA, in key brain regions, measured during a single visit using a 3T MRI scanner. The results were quite compelling. We observed a significant 6.3% increase in paramagnetic iron, or PARA, in the dorsal premotor cortex of PD patients, with a p-value of 0.032. Even more strikingly, there was a 10.2% increase in the substantia nigra pars compacta, a region critically involved in Parkinson's, with a p-value of 0.024. Furthermore, the PARA levels in the premotor cortex showed a positive correlation with disease duration. Importantly, the deep learning approach was found to be non-inferior to established methods for differentiating patients from controls. This study marks a significant step forward, demonstrating that AI-enhanced susceptibility MRI can provide unprecedented mechanistic specificity in mapping iron accumulation in Parkinson's disease. This could revolutionize how we diagnose and monitor the disease, potentially leading to earlier interventions. However, it's important to acknowledge the small sample size and cross-sectional nature of this initial study, which means we can't yet draw definitive conclusions about cause and effect. Moving forward, larger longitudinal studies are crucial to validate these exciting findings and explore their full therapeutic potential. Up next, our 10th paper out of 10, Allele-Specific KRAS Signaling, Shaping Tumor Immunity and Therapeutic Response in Lung Adenocarcinoma by Kostas A. Papavasiliou and Athanasios G. Papavasiliou from First University Department of Respiratory Medicine, Soteria Chest Hospital, Medical School, National and Kapodistrian University of Athens, Athens, Greece. This paper addresses a critical and challenging problem in oncology by investigating allele-specific KRAS signaling, which is highly relevant for developing precision therapies and understanding tumor immunity in lung adenocarcinoma, a leading cause. Let's break down its key contributions. Today, we're diving into the fascinating world of KRAS mutations in lung adenocarcinoma. This paper explores how specific variations in the KRAS gene can profoundly affect how our immune system responds to cancer and how effective treatments might be. Understanding these nuances is critical for developing more personalized and effective cancer therapies. While the abstract isn't available, this type of research typically involves sophisticated molecular biology techniques and preclinical models. Researchers would likely use cell lines and animal models to dissect the intricate signaling pathways downstream of different KRAS mutations. They'd be looking for specific changes in gene expression and immune cell interactions. Unfortunately, without the abstract, we can't dive into the specific numbers and findings. However, we would expect to see data illustrating how different KRAS alleles impact the tumor microenvironment, potentially showing variations in immune cell populations or cytokine profiles. The paper would likely present evidence of how these allele-specific differences translated into varying responses to immunotherapies or targeted agents. This research highlights the critical importance of considering allele-specific differences in KRAS mutations. It suggests that not all KRAS-driven cancers are the same, and our treatment approaches shouldn't be either. Future work will need to translate these mechanistic insights into biomarkers and clinical trials to truly personalize therapy for patients with lung adenocarcinoma. That's all for today's PubMed Daily. If you found this helpful, please like, leave a comment, and subscribe for daily paper summaries. See you tomorrow.